COVID cases are spiking as nearly all of Kentucky's 120 counties are heading into the red. We are told the Delta variant is to blame, but do the numbers back that up? And is the state actually testing for it? Kristen Goodwillie has the answers.
When you go to get tested for COVID, it doesn't automatically also test for the different variants. In fact, tests need to be sent in to verify which variant you have, if any. It can take weeks to get results to be returned, but a new purchase by Louisville Public Health will drastically change how we get this information.
So about 4.5% of the total number of positives go through the sequencing.
As of July 19th, Governor Beshear said that out of the total positive COVID cases, only 4.5% are being tested for variants. We checked back in.
In general, are only able to genetically sequence a very small amount of our positives.
Right now, the tests go to the CDC, where they'll sequence them and determine the variant. It can take a couple of weeks to get results and is expensive.
Basically, what they're saying right now is that we can sequence all we want, but virtually every case out there now, more than 90%, are the Delta variant.
Data from the Kentucky Health Department shows the prominent variant in Kentucky over the course of the pandemic is B117.
In B117, there were a lot of cases. When you think through our winter where we lost so many people, where cases were at an all-time high, that was the UK variant.
Governor Beshear says that this data is cumulative and the Delta variant will soon surpass the UK cases in the state.
The concern is the breakthroughs for the vaccine, so those are automatically going for sequencing.
Continuing to track the cases in our area is imperative.
We understand more about what's the impact on transmissibility, on, is it causing more severe illness? Is it resistant to some of the treatments we have available? So the sooner we know that, the sooner we can help our community and provide timely information about what's really going on.
That's why the Louisville Health Department invested about $150,000 in variant detection equipment.
Once we get positive samples in from patients, we can process those in a couple days and have results.
The system can test 96 samples at a time. We'll have answers on a weekly basis and cost $25 a sample, significantly less than sequencing.
There's just been a lot of challenges along the way to get laboratory information quickly.
For months, we've been asking health officials about the capacity to test and monitor which variants are in the Commonwealth. At the end of June, we did finally receive some of that data. We're continuing to track these trends and press leaders for answers when we do find inconsistencies in the numbers. I'm Kristen Goodwillie, WHAS 11 News.